we're just not going to test because a lot of it isn't going to be, you're not necessarily going to use this as a test. And so we've all omitted it throughout the past, and so I'm going to continue to do that. For the thumb CMC flexion, usually this is a very fine, minute test because you're going to just test that CMC, what it's doing. So not testing necessarily the MCP movement, but the CMC movement of the joint, okay? So this isn't a big movement, and this is not necessarily something that you would test unless somebody had like a CMC, removal of the CMC joint, you know, and it's just very strange. But I want you to test this one just so that you know how to test this, okay? For the CMC, remember you're only looking at the CMC joint. So you're only gonna follow this joint, it's not a big motion. I'm gonna line the fulcrum over the base of the CMC joint, and the forearm is gonna be in supination. The stable arm is gonna be midline of the radius, and then your movable arm is gonna be on that first metacarpal, so that first digit. Okay. And so you're pretty much putting the goniometric kind of in this position on top of the joint. And then I'm gonna ask Emily to bring her thumb in towards her palm. So it's really not a big motion that you're gonna notice. And you have you bring your thumb in towards her palm. And I'm gonna follow just that that line right there over that metacarpal. Okay, so she has about 0 to 15 degrees of CMC flexion. Okay. So this is not something that you'll necessarily see, like CMC flexion, because we don't do anything like that really. But it's a pretty easy test, but you're making sure that you follow that CMC joint. So that CMC joint is what you're gonna watch come over into the palm, okay? And it's pretty simple. Is gonna be tested the same way, okay? So you're gonna line up the fulcrum.
CMC extension.
CMC extension is going to be the fulcrum over the base of the CMC joint. Movable arm is going to be still over that first metacarpal, and then your stable arm is going to be down the radius. And you're going to ask her to move her thumb out towards, like she's going into extension, okay? Emily, can you move your palm out towards the side for me? Good. And I'm still only following that first metacarpal, and the fulcrum is going to stay over that CMC joint. Okay. So she has 0 to almost 30 degrees of CMC extension. The guidelines for even the surgeon's code, they might call it radial abduction. So if you see radial abduction or CMC extension, that's going to be considered the same thing. Okay, so yes.